This meeting of the Caldwell County Board of Education on February 11th, 2022 has been called to order, and we appreciate those who have joined us this morning. There's 6 of us here. Ann has joined us by Zoom, so she will be a part of the meeting. She is out of town, and we just appreciate her being with us this morning. Next item on the agenda is the approval of the agenda, and the board's had opportunity to take a look at it. Do I hear a motion we approve the agenda as presented?
I make a motion we approve the agenda as presented.
Is there a second?
Second the motion.
All those in favor say aye. Aye. Any opposed? And the motion has been approved. Next item on the agenda is I'm going to recognize our superintendent, Dr. Don Phipps.
Thank you, Mr. Chairman. I have a statement that I'd like to read and then some action that I'd like to respectfully request from our board. Throughout this exhausting and frustrating COVID era, with respect to school-based policies and procedures related to COVID, there's been a constant struggle to do what is right, especially when right is defined so differently by different people. We've also struggled with guidance and directions that have changed along the way as circumstances have also changed. Our work has remained focused on maintaining a safe environment while delivering instruction. Our Board of Education has remained committed to supporting efforts to keep students and staff in schools. Our board has been intentional in their work, focused on making the proper decisions rather than the popular decisions. For our board, the greatest concerns have been the safety of students and staff and the exclusion due to quarantines. The work that has been done over the past few weeks is focused on how we can move to an optional face mask status while managing quarantine numbers, and this has been a real challenge. On Thursday, February the 10th, the statewide announcement was made that the Strong Schools Toolkit was being updated effective February 21st, with changes made around contact tracing and the exclusion of asymptomatic contacts in the schools, and this was the biggest issue for us. The changes state that individual contact tracing and exclusion from school for asymptomatic individuals will end. With that announcement, and after a meeting with our local health department leaders, it was determined that we could implement changes immediately and work toward the February 21st changes that were announced. As a result, I would like to respectfully recommend to the Board of Education that the current board policy 421, 5021, 7263 regarding face coverings be rescinded, and that the proposed new policy, which would still have the same number 4231, 5021, and 7263 regarding face coverings as set out in the board agenda, be temporarily adopted. If approved, this change would take effect immediately. Our school system leadership will continue to work with local health officials as we move to make the mask optional environment, with an emphasis on mitigating and managing COVID in our schools while reducing and ultimately eliminating the exclusion of asymptomatic contacts. If this is done today, the approval of this policy is considered temporary based on board policy, which states that the temporary approval may be granted by the board in lieu of formal policy to meet emergency conditions or special events that will take place before formal action can be taken. That permanent action would be sought on Monday night. The reason we want to do this today is to allow us to inform students, staff, parents, and guardians of the change prior to school starting on Monday of next week. As you all know, I would normally make a call today to let the public know what the metric is, and we would do a mask decision for next week. The need today was to go ahead and get this word out so folks would know that we're starting immediately with mask optional if the policy is approved.
Thank you, Dr. Phipps. That being the case, and you've heard what Dr. Phipps has indicated here, do I hear a motion that the current board policy 4231, 5021, 7263 regarding face coverings be rescinded, and that the proposed new board policy 4231, 5021, 7263 regarding face coverings as set out in the board agenda be temporarily adopted?
Mr. Chairman, I move that the current board policy of 4231, 5021, 7263 regarding face coverings be rescinded, and the proposed new policy of 4231, 5021, 7263 regarding face coverings as set out in the board agenda be temporarily adopted.
Is there a second?
Second.
Any comments or questions from the board?
Dr. Phipps, just to clarify, even with the new toolkit, even with our new policy, the face mask policy that's federally mandated on school buses will remain the same, correct?
It will. Mr. Chairman, can I read what we have here, just so the
Yes.
public knows what this is?
Go ahead.
In case you haven't had an opportunity to see it in board docs. It says, though the board encourages students, employees, and visitors to follow public health guidance regarding the use of face coverings while in school buildings, such use is not required at this time. The use of face coverings is required only when on school buses or other school transportation vehicles, subject to the exclusions and exemptions in the CDC order that requires the wearing of face coverings on all public transportation conveyances. The use of face coverings when on school buses or other school transportation vehicles shall only be required so long as the CDC order requiring such use remains in effect. And by including that, that allows us to not require face masks once that federal requirement is eliminated, and not have to come back for that approval.
Go ahead.
What's the recommendation from our school nurses regarding contact tracing and masks?
We have worked with the health department, with local health officials, our school nurses along the way, as you all are well aware. I pulled some numbers, just going back to the 4th of January. This is just in Caldwell County. The number of days that have been missed by students in our school system due to contact tracing and what we have in place just since the 4th of January is 14,167 days of instruction that have been missed. We've had 1,414 work days that have been missed. And that's been a concern of ours because we knew that a lot of the folks that were out on quarantine never developed symptoms, but we were following the toolkit, doing the work that needed to be done behind the scenes, trying to work with the health department and our health leaders to find a way to follow the guidance, to be safe, but also to keep more students in. For the public, I want you to realize that had we gone mask optional, the quarantine numbers would have gone up. And our conversations have been, how do we remove the masks, but also manage the number of individuals that are missing work? So yes, we've met with nurses repeatedly. I had a chance to sit down with leadership at the health department yesterday. We've had conversations and we're on the same page as we move forward, again, to mitigate and manage the numbers not only of the people that are out, but also the effects of the quarantine as we move forward. You know, at this point, we get to a place where if you're sick, we encourage you to stay home. And if you're well, then we want you to be here, and we'll continue to monitor symptoms and do those kinds of things. There is a requirement in the new guidance that comes out that we have to notify individuals if they've been in contact with someone, and we'll do that. And we've been doing that with a letter that goes home and encouraging parents and guardians to monitor their students for symptoms and communicate with health officials and the folks in our schools to make sure that we take care of that. Good question.
Any other questions?
I would just like to say, we've always, before COVID, encouraged people if they're sick to keep their child at home or staff. So hopefully we're heading back toward that where it comes back to the parents' responsibility of if their child's sick, they keep them home. I mean, not only for COVID, but all the other factors that are involved.
And Chairman Penn, I'd like to publicly say that I'm asking the parents and the public to really be vigilant in that, because if your kid is sick or showing symptoms and you still send them to school, that's just increasing the spread of COVID, and it's going to cause problems. So I'm publicly asking you guys to watch your kids, look out for the symptoms, and if they're sick, I know it's tough sometimes, but try to keep them at home so we can control this. Thank you.
Any other comments or questions? Okay, hearing none. All those in favor of the motion, say aye.
Aye.
Any opposed? And Ann, I'm going to ask you for your vote, since you are joining us remotely.
Aye.
Okay. So the board has voted unanimously to accept the recommendation of the superintendent. I want to thank the board and Dr. Phipps, along with his team, for their tireless efforts in dealing with this situation. We know it's not over, and we're going to continue to work just as hard as the days go by. Many, many hours, days, and months have gone into this effort. We understand the passions on this matter from all sides, but we have been focused from the beginning on the safety of all our students, teachers, and staff. And we have also been focused on keeping our students, teachers, and staff in school and at work. Again, thank you to the board for your many meetings, hours spent on this, and especially to Dr. Phipps and to his entire staff. It's been a lot of work. Nobody can possibly imagine the time that has been put into this. And certainly thank you to our teachers and our administrators who have done a absolutely commendable, wonderful job during this time. With no further business, do I hear a motion we adjourn?
Make a motion, we adjourn.
Is there a second?
Second.
All those in favor say aye.
Aye.
Any opposed? And we are adjourned. Thank you for being here. Have a great day.